Today, we will be discussing type 2 diabetes. Type 2 diabetes, also called type 2 diabetes mellitus, is a disorder that affects the way your body uses glucose or sugar, and it also causes other problems with the way your body stores and processes other forms of energy, including fat.
It's Doctora Victoria and George.
Every cell in your body needs sugar to work normally, and insulin, a hormone, helps sugar get into your cells. However, if there's not enough insulin or your body stops responding to insulin, such as insulin resistance, sugar builds up in your blood, and that is what happens to people with diabetes. High blood sugar levels can lead to problems if untreated. There are two different types of diabetes. Well, there are more, but we'll kind of touch on two. Type 1 and type 2. In type 1 diabetes, the pancreas, an organ in the abdomen, it sits just behind the stomach, stops making insulin. In type 2 diabetes, the body stops responding to normal or even high levels of insulin, and over time, the pancreas does not make enough insulin. Approximately 90% of all people with diabetes in the United States, Canada, and Europe have type 2 diabetes. Being diagnosed with type 2 diabetes can be a frightening and overwhelming experience. Poor George, he ended up in the ICU. Perhaps you have questions about why it developed, what it means for your long-term health, and how it will affect your everyday life. Fortunately, there are treatments available that can keep your blood sugar levels under control and minimize your risk of developing complications. Type 2 diabetes can lead to lots of health complications, some of which can be very serious. However, there's things you can do to reduce your risk of these problems. Most people with diabetes lead active lives and continue to enjoy many of the foods and activities they previously enjoyed. Diabetes does not mean an end to special occasion foods like birthday cake, and most people with diabetes can and should enjoy exercise in almost any form. Exercise is particularly important because it is the only time that your muscle cells are able to draw sugar directly out of your blood and use it as energy for the muscle cell. This is only happening when you are working hard. Again, that huffing and puff is not going to happen if you're just doing a lackadaisical walk. It has to be true, proper exercise, but it helps bring down sugar levels when we do that. And it's the only time your body is able to use glucose or sugar without needing insulin. So it gives your pancreas a little bit of a break. Type 2 diabetes is thought to be caused by a combination of genetic and environmental factors. Eating an unhealthy diet and not getting enough exercise, this can lead to weight gain, which increases your risk of developing type 2 diabetes. A small number of pregnant women develop diabetes during pregnancy called gestational diabetes. Gestational diabetes is similar to type 2 diabetes, but it usually resolves after the woman delivers her baby. But women who develop gestational diabetes during pregnancy are at increased risk for developing type 2 diabetes later in life. The diagnosis of diabetes is based upon your symptoms and the results of blood tests. The main test doctors use to diagnose diabetes is a blood glucose or sugar test, which can be done in several different ways. And if we're measuring sugar levels in your blood, we want two readings to know if they're always high before we give that diagnosis of diabetes. There's another test called the hemoglobin A1C. This tells me the average sugar levels you've had over the past 3 months. We measure how much sugar has been stuck on your red blood cells. And since red blood cells live about 3 months, and you cannot cheat or say, oh, I just had a big meal or a cake last night, that's why it's high for this test. I know the sneaky ways of the patient. So if you have just been diagnosed with diabetes, you and your family should use this time to learn as much as possible so that caring for your diabetes becomes part of your daily routine. Your doctor or nurse can help answer your questions and talk to you about what to expect. They can also direct you to resources for medical as well as psychological support, such as group classes, meetings with a registered dietitian, social worker, or nurse educator, and other educational resources such as books, websites, or magazines. George, it's true, he had a bit of a traumatic time in the ICU when he got his new diagnosis of diabetes right over here. So whether this is an older diagnosis of diabetes that maybe isn't managed so well, or it's a new diagnosis of diabetes, work with your healthcare team and your provider to make sure that you're on the best therapy so that we can help keep those side effects at bay and those complications at bay. Thank you for joining us today, my healthcare team. I hope you'll join us next time to see what George gets up to next. Bye-bye.